Well, World Health officials are closely monitoring a developing situation in India right now after 2 cases of the Nipah virus were confirmed. The rare but deadly disease spreads through fruit bats, pigs, and human-to-human contact. Now, the virus was first identified in 1999 and has caused periodic outbreaks in Asia, but health officials are anxious to contain these cases as quickly as possible. The 2 cases of Nipah virus were detected in India in the state of West Bengal, but there are concerns the outbreak could spread. According to the World Health Organization, the virus has a fatality rate of 40 to 75%, far deadlier than the COVID virus, and there's no vaccine for Nipah. Authorities in India are taking no chances. At the same time, several airports across Asia, in Thailand, Singapore, Malaysia, and Hong Kong, are taking steps to screen passengers for any symptoms. Nipah is transmitted from animals, usually fruit bats or pigs, and doesn't spread easily to humans. But in past outbreaks, the virus has spread from person to person, especially among close contacts and caregivers. It can also spread through contaminated food. When Nipah does hit, it initially feels like the flu, then worsens. Experts say pneumonia and other respiratory symptoms can develop. The most serious complication is encephalitis, or inflammation of the brain. There's no specific cure, just supportive care for symptoms. The World Health Organization says the fatality rate has a lot to do with the country's capacity to test, trace, and treat those infected. In India, authorities have quarantined nearly 200 people who may have come in contact with the 2 infected. It's the first time in nearly 20 years that India has had cases, but they believe the outbreak is now contained. U.S. health officials are also watching the situation very closely. The CDC says it's ready to assist if needed.